Main health problem: spinal compression, chronic back pain, nerve impingement, disc degeneration, and loss of mobility due to gravitational stress and age-related spinal deterioration. Main promised solution: back on track decompression, a specific therapeutic approach designed to relieve spinal pressure, restore disc height, and eliminate chronic pain. Why this problem is dangerous for seniors. Spinal compression affects over 80% of adults over 60, leading to debilitating pain, pinched nerves, reduced mobility, and loss of independence. Without intervention, compressed discs can cause permanent nerve damage, chronic inflammation, and a cascade of health problems, including poor sleep, reduced physical activity, muscle atrophy, balance issues, and increased fall risk. Many seniors become bedridden or require surgery when non-invasive solutions could have prevented deterioration. Why the solution is critical. Back on track decompression offers a medically backed, non-surgical intervention that can reverse years of spinal damage compression. For seniors facing limited treatment options beyond pain medication or risky surgery, this approach represents a path to reclaiming mobility, independence, and pain-free living. Full YouTube script: Back on track decompression. Hook: 0 to 45 seconds. Visual: close-up of elderly person wincing in pain while standing. Narrator: right now, as you're watching this video, your spine is being crushed. Every second you sit, stand, or walk, gravity compresses your vertebrae by up to 1% of your height. For someone over 60, this isn't just discomfort, it's a medical emergency happening in slow motion. Here's the terrifying truth: 84% of adults over 65 suffer from chronic back pain caused by spinal compression. But here's what your doctor isn't telling you. Within just 18 months of untreated disc compression, you face a 340% increased risk of permanent nerve damage, a condition that can leave you with numbness, paralysis, or complete loss of bladder control. And the worst part? Most people don't realize they're losing the battle until it's too late, until they can't walk to the mailbox, can't play with their grandchildren, can't sleep through the night without waking up in agony. But what if I told you there's a medically proven decompression method that's reversing decades of spinal damage without surgery, without injections, and without a single pain pill? Visual: text overlay: back on track decompression. Authority block: 45 seconds to 115 seconds. My name is Dr. Michael Brennan, and over the past 22 years, I've treated more than 8,700 patients suffering from chronic spinal conditions at the Advanced Spine Relief Center in Phoenix, Arizona. I've worked with former NFL players, construction workers, teachers, and everyday seniors who were told by their doctors that surgery was their only option. And I've watched 91% of them achieve complete or near complete pain relief using a revolutionary approach called back on track decompression. This isn't some trendy wellness fad. This is FDA-cleared, clinically validated spinal therapy that's been studied in over 14 major medical trials, and the results are nothing short of extraordinary. Today, I'm going to show you exactly how this works, why it's the most effective non-surgical treatment for spinal compression available today, and how you can access it, even if you've been suffering for years. Visual: Dr. Brennan in white coat, credentials displayed on screen. Setup: the science, 1:15 to 2 minutes. Let's talk about what's really happening inside your spine right now. Between each of your 24 vertebrae sits a small gel-filled cushion called an intervertebral disc. Think of it like a jelly donut. When you're young, these discs are thick, hydrated, and resilient. They absorb shock, allow movement, and keep your nerves protected. But after age 50, everything changes. Your discs begin to dehydrate. They lose up to 30% of their water content. They flatten, they bulge, and as they compress, the space between your vertebrae shrinks. Now here's where the real damage begins. As that space closes, your spinal nerves, delicate highways of sensation and motor control, become pinched. Blood flow is restricted, inflammation floods the area, and your body enters a vicious cycle of pain, stiffness, and further deterioration. This is called degenerative disc disease, and it's the leading cause of disability in adults over 60. The medical community has known about this for decades, but until recently, the only options were dangerous: spinal fusion surgery, steroid injections that destroy cartilage, or opioid painkillers that create addiction without addressing the root cause. Debunking segment, 2 to 3 minutes. Before we get to the solution, let me destroy 3 myths that are keeping you in pain. Mistake number 1: relying on pain medication. Scientific danger: NSAIDs like ibuprofen and naproxen don't heal your spine. They mask the pain while allowing further damage. Worse, a 2019 study in the Journal of the American Geriatric Society found that long-term NSAID use in seniors increases the risk of gastrointestinal bleeding by 450%, kidney failure by 230%, and heart attack by 64%. Surprising study data. Patients who relied on pain medication for spinal compression experienced an average progression to surgical intervention within 3.2 years compared to those who pursued decompression therapy within 8.1 years. Patient story. I treated a 68-year-old woman named Linda who had been taking prescription pain medication for 6 years. Her discs had deteriorated so severely that she developed spinal stenosis, a narrowing of the spinal canal that required emergency surgery. She told me, "I thought the pills were helping. I had no idea they were just buying time for my spine to collapse." Mistake number 2, believing bed rest will heal you. Scientific danger. Prolonged bed rest weakens the paraspinal muscles, the critical stabilizers of your spine. Within just 72 hours of inactivity, these muscles begin to atrophy at a rate of 1.5% per day. This creates instability, worsens compression, and accelerates disc degeneration. A 2021 study published in Spine Journal found that patients who remained sedentary for more than 5 days experienced a 78% slower recovery rate compared to those who engaged in controlled movement and decompression therapy. Patient story. Robert, a 72-year-old veteran, spent 3 months in bed after a severe back flare-up. When he finally came to see me, his core strength had deteriorated so badly that he couldn't stand for more than 90 seconds without support. It took 9 months of rehabilitation to rebuild what 3 months of bed rest had destroyed. Mistake number 3, waiting for surgery as your only solution. Scientific danger. Spinal fusion surgery, the most common procedure for severe compression, permanently eliminates motion between vertebrae. This places enormous stress on adjacent discs, causing what's called adjacent segment disease. Within 10 years, 60% of fusion patients require additional surgery. Complication rate for spinal surgery in patients over 65 is 31%, including infection, blood clots, nerve damage, and failed fusion. Recovery time averages 6 to 12 months, and 22% of patients report worse pain after surgery than before. Patient story. Margaret, age 71, was scheduled for a 2-level fusion. She came to me for a second opinion 1 week before surgery. After 12 weeks of back on track decompression, her pain decreased by 89%, her mobility returned, and she canceled the surgery. That was 4 years ago, and she's still pain-free. Visual, before and after MRI scans, patient testimonial clips. Solution segment, 3 to 4:15 minutes. So what is back on track decompression, and why is it working when everything else has failed? The science. Back on track decompression uses controlled, computerized traction to create negative pressure inside your spinal discs. Here's how it works. You lie comfortably on a specialized table, a harness is secured around your pelvis, then over the course of 20 to 30 minutes, the table applies gentle, precisely calibrated pulling forces to your spine. This creates something extraordinary, negative interdiscal pressure. Think of it like a vacuum inside your disc. As the vertebrae separate, bulging or herniated disc material is pulled back into place. Nutrient-rich fluid floods into the dehydrated disc. Inflammation decreases, pinched nerves are released, and your body's natural healing mechanisms are activated. Clinical results. A landmark 2018 study published in the Journal of Korean Neurosurgery Society followed 219 patients with chronic disc herniation who underwent decompression therapy. The results were staggering. 86% experienced significant pain reduction within 4 weeks. 71% achieved complete resolution of radiating leg pain. 63% showed measurable increases in disc height on follow-up MRI, and 91% avoided surgery entirely. Another study from the BMC Musculoskeletal Disorders Journal found that decompression therapy improved functional mobility scores by an average of 58% in seniors over 65, allowing them to return to activities like walking, gardening, and traveling without limitation. Specific action plan. Here's exactly what you need to do. Step 1. Find a certified decompression provider. Search for clinics offering FDA-cleared spinal decompression tables like the DRX 9000, SpineMed, or Back on Trac systems. Not all traction devices are the same. Make sure the facility uses computerized, non-surgical decompression technology. Step 2. Commit to the protocol. Most patients require 20